Cynthia, you work with IMC
Integrated mechanical care, yes.
And tell me about the company. What does the company do?
You know, this is a remarkable small company. The company has developed a musculoskeletal solution that has the outcomes that have been unprecedented in the industry. So the company has a reliable assessment process, a care strategy, and a case management strategy that is quality assured and results in more than 75% of individuals getting better in 6 visits or less, which is usually 6 weeks or less, and 15% more who get well in the next 3 months. So there are fewer than 10%, usually 3 to 10%, who might need escalation to other types of caregivers, but the vast majority are resolved right in the clinic.
Okay, so what is particularly interesting about this data given the changes that we're seeing on the healthcare landscape now?
Well, I think it's very unusual to find a solution that is very low cost, very easy on the patients, very low tech, frankly, and that is able to have unprecedented outcomes. I think a lot of us have sort of begun to believe that we have to have very high cost, invasive interventions to get better, and this is one of those delightful organizations that is showing that is not necessarily so.
Give me an example of how it works, how some of the work that you do at the company is applied to everyday patients.
Well, there are several different great examples. One example is in Tallahassee. There is an HMO, very high quality HMO, that for some years had been having challenges of being ranked, I believe, 95th in the nation in terms of orthopedic surgeries. They had just a tremendous number of orthopedic surgeries. And this clinic was able to go in and help them dramatically reduce the number of orthopedic surgeries while maintaining patient satisfaction rates of 97% and higher. So the whole community has had an enormous lift in the incidence and prevalence of musculoskeletal disorders. The incidence and prevalence have dropped, the health of the population has risen dramatically, and it has benefited the employers in the region, socioeconomic development in the region, and of course the HMO.
What is, do you think, a clear advantage for employers to know more about what you're doing?
Well, this is a solution that addresses maybe 10 to 20% of the healthcare spend for Fortune 500 companies. So let's say a Fortune 500 company is spending $300 million in their group health spend. This would be addressing 10 to 20% of that, so $30 to $60 million. And the solution is guaranteed to save 25%. So it can save easily $15 million for an employer within 12 months.
Mm-hmm. And do you think that the message is being clearly heard by employers now, that they're more open to more interesting and unique solutions to their healthcare costs?
Yes, I think, I mean, to the credit of employers, especially those who are self-insured, they've been looking for solutions for a long time, and I think the challenge has been it's been hard to find those solutions. So when we are introduced to employers, they are very interested. It's hard to find a solution with a guaranteed set of outcomes. And in addition to the outcomes we have around the cost of musculoskeletal care, we guarantee patient satisfaction at 97% or higher, and functional improvements of 25 to 60%, and pain reductions of 60% or more. So and all of that very rapidly in the first 6 weeks. So we are well received by employers. I think they have very savvy folks working for them who are interested in the well-being of their employees and their productive capacity as well, and we're able to help with earnings.
Okay, terrific. Is there anything that I've missed that you'd like to add?
Well, I think that there's a very human story around musculoskeletal disorders. Most of the adult population eventually suffers from these. In any given year, it's 30% or more. And this is a solution that can help all of those people. So it's a solution with widespread favorable implications that enable people get back to the lives they love. So it's a very heartwarming, wonderful solution with a nice economic story too.
All right. Cynthia, thank you so much.
Thank you. Appreciate it.